Just days after President Mahama inaugurated this state-of-the-art catheterization laboratory, it has become a beacon of hope. Patients from every corner of Ghana are arriving, many for the only chance to reclaim their lives.
So this cath lab was badly needed.
The steady stream of patients tells its own story. Ghana had waited too long for a facility like this. Today, through the intervention of the Ghana Medical Trust Fund and the Ministry of Health, hope has been restored.
A lot of people have been waiting for this day. As you can see, within 1 week, we are having to treat over 30 people from all around the country. This is a premier facility with the biggest and best cath lab, which serves the entire nation.
It's been extremely helpful because after the old one was gutted by the fire, cases had to be on hold. And so with this new facility, it's a step in the right direction. We are going to get a lot more cases done, and that's going to help a lot more people.
We ask for permission to join the medical team inside the cath lab. The answer comes almost immediately, yes. Moments later, we are suited up in lead protective gear specifically designed to shield us from X-ray radiation. Beyond these doors lies the heart of this life-saving facility. Bright surgical lights flood the sterile room. Monitors pulse with vital signs. Every eye is fixed on one patient, an 80-year-old woman whose failing heart has brought her here, inside this cath lab. Every second counts and every heartbeat matters.
This is a patient who already has a pacemaker that has been in there for 10 years, and the pacemaker battery is depleted. And so one of the things we are here to do is to change the pacemaker. But she also, for several reasons, needs to be upgraded from a pacemaker to another electronic device called a defibrillator system.
Leading today's procedure is Dr. Kamel Addo, a member of a medical mission from the United States of America, working alongside specialists at the National Cardiothoracic Centre. Together, they are combining expertise to deliver life-saving cardiac care.
We've established a very important and I think enduring relationship with the cardiovascular, the National Cardiothoracic Centre, where we collaborate, and the main purpose of that is really to build relationships with the institution through which we can then transfer knowledge and skills.
Inside this state-of-the-art cath lab, every second is precious. A highly skilled team of cardiologists, nurses, cardiac physiologists, radiographers, anesthetists, and biomedical engineers prepares for the delicate task of replacing a cardiac pacemaker. The room moves with quiet precision. Sterile instruments are laid out. The imaging system is checked one final time. Every surface has been disinfected, every instrument accounted for. In here, nothing is left to chance because every detail could mean the difference between life and death. The patient is awake but calm under local anesthesia and light sedation. Every heartbeat is monitored in real time. After carefully sterilizing the chest, Dr. Kamel Addo makes a precision incision along the existing scar, minimizing further trauma. Slowly and deliberately, he works through the tissue until the pacemaker pocket is reviewed. Every movement is measured, every decision deliberate, where years of skill meet life-saving precision.
Her condition is that she has a condition called complete heart block. And people with complete heart block need pacemakers. Okay, so she had that done 10 years ago, but her heart condition has worsened in part because of the pacemaker. So we need to upgrade the pacemaker to a very complex form of pacemaker to help improve her heart, and then also to give her a defibrillator.
This is a dangerous condition where the electrical signals from the upper chambers of the heart can no longer reach the lower chambers. As a result, the heart beats far too slowly to pump enough blood to the body. Dr. Adu carefully retrieves the decade-old pacemaker that has kept this woman's heart beating for the past 10 years. With precision, he creates a tiny access point and guides a thin pacing lead through a vein into the heart. Using real-time X-ray imaging, he tracks every movement of the wire as it reaches the right ventricle, the chamber responsible for pumping blood to the lungs. And this life-saving procedure is happening right here, inside the Ghana Medical Trust Fund Cardiac Catheterization Laboratory, where every member of the team understands the importance of the movement and the responsibility it carries.
I think this being in session now is a great opportunity. It will reduce the burden on the other facility as well, and it also helps the staff to learn, and then acquire more knowledge and skills in cardiac catheterization.
It may interest you to know that we have one patient from Liberia and one patient from Burkina Faso who are joining the cohort for the first service. So it's been very, very timely in its commissioning, and I'm not sure what we would have done to the patients who needed them if it was not ready at this time.
A lot of patients who require devices, and we don't end up doing the cases because they can't afford. So we hope that we should be able to reach somewhere where a lot of people can benefit from these therapies.
Back to the action. The anesthesia team remains vigilant, closely tracking the patient's heart rhythm, blood pressure, and oxygen levels throughout the procedure. Every vital sign is watched carefully, ensuring safety as the team works to restore her heartbeat. The pacing lead has also successfully gone through the vein into the heart, and it is in perfect position.
I'm ready. Pace at 110.
It has been tested to ensure it can reliably stimulate the heart. Every heartbeat is closely monitored on the screen to confirm that the heart is responding correctly.
Okay, count to 3.
3, currently at 3.
You lost 1. And again. See what I was telling you?
Still have
See
it.
what I was
Still
telling
have
you?
it.
The pacemaker is being programmed to deliver electrical impulses whenever the heart's natural rhythm slows or stops. Instantly, the heart regains a steady, reliable rhythm, restoring normal blood flow to the brain and the rest of the body.
We had some difficulties because she had a vein that was closed up that we have to, in order to get these pacemaker wires through, we had to get them to be open. So we had to spend some time getting the vein to open and then be able to put in the wires and do the procedure. So it was complex.
The nearly 4-hour procedure may be over, but the final task demands the same level of precision. Suturing is a delicate art. Every stitch, every knot must be exact. With steady hands and careful attention, the surgeon closes the incision, bringing the operation to a successful end. And without this cath lab, this life-saving movement may never have been possible.
I feel fulfilled. Our training is to save lives, and therefore, if we have the necessary equipment, the necessary facilities to deliver on our mandate to save the patients who need them most, that is the height of fulfillment. That is the height of happiness, and I'm very happy that we are able to serve these patients.
We're very excited about this new cath lab, and it's made it easier to collaborate with patients and with staff from here, so that these procedures can be done over here. So the equipment is really good, and it helped us do these procedures. Without this equipment, we would not be able to do the procedure.
For more than a year, these life-saving skills lay dormant. Today, thanks to the new cath lab, the surgical team can once again do what they do best: save lives.
It was a good learning curve for all of us. Since after our fire outbreak, this is our new center now, and We are very grateful for the team that came here to help us understand cardiac catheterization as well.
As I mentioned to the president in my speech at the commissioning, this cath lab is going to be very busy. Next week, we have more cases slated, the following week, and every week, adults, children, and all kinds of heart diseases that require a cath lab to be treated will be served over here. And so week after week, day after day, you see us, we are immediately going into an overdrive to clear the backlog, and then we'll get back into our normal routine of constant availability of the service.
We just want to thank the Ghana Medical Trust Fund for this initiative. We are very grateful, and we hope that this would be able to help a lot of Ghanaians with cardiac problems.
For someone living with complete heart block, like this 80-year-old woman, this life-saving procedure can mean the difference between repeated fainting spells or even sudden death and returning to a normal, active life. At the Ghana Medical Trust Fund, this is what we stand for. We restore not just a heartbeat, but hope, independence, and the promise of many more years with loved ones.
The Ghana Medical Trust Fund has not been around for very long, but its impact has been huge. And we cannot be grateful enough to the president for setting it up, and then for the administrative staff who are managing it for the wonderful work that they are doing.
Mahama truly cares, every donation, every